Health Talk Live with Liz, sponsored by TriHealth.
Afternoon once again in Health Talk Live today. We are moving forward in the fight against the coronavirus. So we met up with the TriHealth team to talk a bit more about vaccines, the origin of the coronavirus, and what's happening in your hospitals with COVID cases.
So the number of cases in the hospital has gone down, but we still have about 20 patients in our system, and it's been steady like that for a couple of weeks, so it's not completely going away. Regarding vaccines, the Vax-A-Million program has increased our demand for vaccines, so that's a good thing. We're seeing more and more people, particularly younger people who haven't been vaccinated, coming in and getting their vaccine now.
Okay, so a couple things have come up since we talked to you last. One of them was kind of some new interest in where this virus came from. So what are your thoughts about that?
Well, it's very concerning that we haven't found a natural source for this virus that caused this pandemic. There's obviously some concern about whether this could have been an escapee from the lab in Wuhan. There are reports of some lab workers there being ill right before the outbreak was detected in December of 2020. So it's very concerning, and we need to know more about that.
So I think that there's sort of a lack of understanding about why we need to know that. How will it help us prevent another pandemic?
Yeah, so if we know where this virus started, then hopefully we can prevent future pandemics. So if this is a natural virus that jumped from a bat to an animal to a human, then we need to know what that intermediate source animal is so that we don't expose ourselves to those animals or to those bats. If it was an escape from a lab by an accident, then we need to improve our processes in the labs so that lab workers don't get infected with this and carry it outside.
Yeah, none of us want to have another pandemic, and I'm guessing the secret right now is to get more people vaccinated. And many people have asked me, so why do some people seem to get a lot of side effects and others don't?
Yeah, nobody really knows the answer to that yet. There are probably some subtle differences in a person's immunity that causes some people to have a lot of side effects and others almost no side effects when both get a good result from the vaccine and are immune.
And the one universal thing I think, which has been like sort of the reported side effect is, man, I had a sore arm from this, nothing like the flu vaccine or anything. What do we think is happening there?
Well, this vaccine is formulated to trigger a very robust immune response. So the first place where the immune response starts is in your arm where you got the shot. So it's sore for a couple of days, sometimes swollen, sometimes people even get a red mark in that area. And so that's just your immune system appropriately responding to this vaccine.
So given that then, are we getting closer to herd immunity given there's some natural immunity as well as the vaccines now?
Well, I think the fact that the number of cases of COVID continues to go down is pretty good evidence that we've got enough people in the community who are at least partially immune to stop the rapid spread of this virus. Now, whether or not that's going to completely stop, we'll just have to wait and see now that we're taking off our masks and going back to normal. The people who are unvaccinated are still going to be at risk, so we'll see if we get another bump in cases.
So a lot of people have said, I'm not vaccinated, but I'm wearing a mask, and that's just as good.
Well, those vaccines are really, really effective, 95%. We don't think the masks are that effective. They're certainly better than not wearing a mask, but they're not as good as 95% in preventing infection.
A lot to learn each day. Tell me what you're talking about, the coronavirus or anything else health-related on your mind. You can shoot me an email or hit me up on Facebook or Twitter. That address is @LBonis1.